Hello again. I wanted to just express how nice it's been, the response I've received from my introduction video. I've had a few people message me and just generally like positive feedback, so it's nice to know that I've hopefully doing a good thing, and hopefully people are looking forward to the content. I'm quite nervous about this video. So the last video felt a bit freer talking because it's just in general, but this is about a particular subject, but I feel like it's really important. It's been really important to me, and I feel like it's something that really needs talking about properly and to be more out in the open. I genuinely believe this video could help save someone's life, and I generally believe that this video could enrich and make a lot of people live a healthier and happier life. So that's the reason why I'm making this video. As difficult and as unusual it might be a topic for someone to talk so openly about, I feel like the only way of making things better is to talk about it, and it's nothing to be ashamed of. If anything, it's something to be proud of. And so yeah, I will be talking about it now, and hopefully you'll be listening, and we can go from there. I don't plan any of these chats. You can probably tell by how erratic they are. I have a few notes because this one's quite an important subject, and so I have a few key points, but other than that, I'm just going to talk openly and yeah, freely. Okay, so firstly, the video, the men's health movement. So men's health, in particular men's hormone health. So when we talk about TRT or HRT, 95% of people will think of women and think of the menopause, which rightly so is a recognized condition and is something which is treated and well known, well talked about, and those women that go through the struggle of menopause are treated and their lives are made better for it, which is right. So testosterone deficiency in males is an increasing problem. It's a problem which affects us greatly, and it's a problem which isn't being addressed. And I believe it has a lot of well, I don't believe, it's proven to have links to depression, anxiety, low mood, low energy, low sexual function, and therefore I'm believing contributing to male suicides and the epidemic of male mental health struggles. So this, I believe, is an important thing to talk about, and it's an important thing that men know about. I've even spoken to a few men that didn't even realize that this was a thing, didn't realize that men's testosterone declined. I know a lot of people tend to know that we lose about 1% of our testosterone since around the age of 30 to 40. It drops. It's a slow decline, which is true. So a few facts about testosterone deficiency. So on average, the male nowadays has 25% less testosterone than males in our grandfather's generation. So various studies done on this. I believe between around 1980 and 2000, a study was done and the drop was about 17%, which is huge. They believe not only does the average man's testosterone drop by 1% personally, but also the average of males' testosterone is also dropping around 1% per year on average. So it's a huge decline, and it's not healthy for us. We haven't evolved to function like this. This isn't good for us, and it isn't something we should just accept and man up, because to be a man is to be how we are supposed to be, to feel good, to feel happy, to feel healthy, to function well. I can't, you know, it's not right that this is going on. So my quick story, I'll tell my story and how I got onto this. So when I was about 16, I had quite bad acne. I was going through puberty, growing a lot, and I had reasonably bad acne, but not terrible. Obviously I was bullied about it a bit, and obviously when you're at school and stuff like that, you know, you want to get girls and you don't want to have a spotty face. So I remember having all of the ointment treatments, all of the creams and everything, and for a year or so, like, nothing really touched it. And obviously my mum was worried about me, and it was something I was struggling with. So we eventually got referred to the hospital, and I was given a drug called Accutane, or Roaccutane at the time. Chemical name is isotretinoin. I won't go into that. I will do another video about that, because that's a big one. But all I will say is, if you have children, or if you know of anyone that's thinking about taking that, do not take that drug. Anyway, this chemically castrated me to a sense. I no longer grew anymore after that point in height, about 16, and I then spiraled into a really negative life, and for a long time could not work out what was wrong with me, like I pointed to in my initial video. I remember, so the things I struggled with: low mood, low energy, no focus, no drive, no sexual function, to be fair. Nocturnal erections completely gone, which is the first point of call for a man's health. We're supposed to get them every single night. So about 17 years, none of that. Really nice. Obviously I can talk about it now because that's not a problem, but at the time it's not fun, and there's nothing more depressing than that, on top of all the other problems that it brought to me. Around the age of 30, I started to watch documentaries on this drug and how a lot of teenagers had committed suicide after going on it, and how their parents had, you know, seen their happy children take a drug, and then all of a sudden they're committing suicide. I then started looking into this, and finally starting to believe that maybe there was an answer for the things I'd struggled with for so long, and why I just didn't feel right, and I couldn't work out why. Through forums, which are brilliant, I then saw a lot of people mentioning about hormone deficiencies, and how this drug basically reduces all your androgens. This has now been proven in the British study of medical testosterone decline, and how isotretinoin treatment, along with another drug called finasteride, which is for male pattern baldness, can cause permanent long-term sexual dysfunction. So yeah, all good. So I then started to go back to the doctor, and I said I would like to be tested for everything, because I'm certain this drug I took when I was a teenager has done some damage, and I want to know exactly what could have happened to me. So they did tests, and I was phoned up and told everything's fine, everything's normal. So with blood tests, if you fall into a range, if the range is 20 to 40 and you're 20.1, you are normal, and you'll be told you're normal and sent on your way. I then went back in, and I wanted to confirm what they had tested for. So I got a copy of my bloods, and it had done all the regular bloods, lipids, other things, but not thyroid and not hormones. So I then asked for the hormones to be checked, and when they checked for my testosterone, it was very low on the scale. So again, the scale for testosterone in males tends to be around, it depends on where you get it checked, but let's say it's between like 10 and 30. And if you're, say, that's not age related, so technically an 80-year-old would usually be down the bottom, 80, 90-year-old, and then obviously when you're younger, your testosterone's higher. So mine was right at the bottom. I then queried this, and I wanted it checked again. I went back, and I'd done loads of research, and a lot of the research was stating to not only that this drug I had taken could have caused the problems I was dealing with, but also how having testosterone at that low and being symptomatic with the problems, you are eligible for treatment. There's various guidelines for this, and it's something that should be treated at those levels. I was refused on numerous times, even though I had blood tests to show that I should be taking it, and the studies and the story behind everything I've been struggling with. I remember going to 3 separate GPs and receiving things said to me such as, you've got facial hair, so you can't have low testosterone. A female doctor said to me, we would only ever treat low testosterone if you'd had your testicles removed, which is just complete nonsense. And then I think the third guy spent 10 minutes just trying to give me antidepressants. Yeah, so I gave up at that point with trying to get myself treated through the NHS, which is a sad state of affair, but there's many people that have had this too. So I was part of a forum at this point, and lots of men discussing the struggles that they had been through and how much of how they've been treated, basically going in and just generally asking for help, not to have testosterone because they want to suddenly be huge, but because they're struggling mentally, physically, and yeah, feeling really, really low and wanting help, basically, and asking for help. I then heard about a place in Poole called the Men's Health Clinic. So I spoke to them. I drove down to Poole. I showed them the blood results I'd had from the NHS. They then did their own blood test results, which confirmed that I was low in testosterone, and also free testosterone and estrogen, which are the key main hormones for men. When you mention estrogen to people that know about hormones, you tend to think of women, but obviously men is very important for estrogen in terms of mood, sexual function, bone health, everything, just as equal as women has testosterone, just at lower levels. So you have to look at the whole picture. So I then was initiated and started on treatment of testosterone replacement therapy. This was like a huge moment in my life. I remember what had felt like, well, almost 2 decades of just feeling like there was something wrong with me. I can't really explain it better, and just being sad and really, really lost, thinking like, what's wrong with me? I was socially just unable to function, even around my family. Like I said, the sexual anxiety, and I was just non-existent, basically. Like I didn't exist as a person. That it's sad to think back on it now, based on how I feel now, but the reality was it was just really, really bad time. So I remember the sense of relief of coming back after I was initiated on treatment was like the best feeling ever. And then what came after that was everything I'd hoped for. It was initially my sexual function back, which yeah, mood started to get better, body composition started to change. I was able to go to the gym and keep going to the gym rather than go to the gym and then be burnt out. But just generally everything got better. Like there's obviously pros and cons to everything, and I'm not going to say it's been a perfect journey. You have to monitor things, you have to check yourself, you have to adjust your dose to make sure it's in ranges, and perhaps add in certain things to control estrogen if that goes high, because we convert our testosterone into estrogen through aromatase, which is through body fat. So again, men that have higher body fat aromatize more, they'll have lower testosterone. So there's some things you have to monitor, but overall, just I would never ever have changed going on it. And obviously it'll be something I'm on for the rest of my life, and I truly believe I will live a longer, happier, healthier life and more fulfilling life because of this. So this was something that I kept to myself. It was something I was a bit ashamed of. If people would ask me if I was natural, I would say yes. I wouldn't ever want to talk about it, until sort of a couple of years ago, when I kind of found myself a bit more, and I'd sort of learnt my new self and felt comfortable in my skin. had quite a traumatic breakup, and then just really started to just believe in myself and believe how you shouldn't be ashamed of anything that you're doing to better yourself, or as long as you're not hurting somebody else, and it's not something to be ashamed of. So I would talk openly about it to anyone. People will quite often speak to me at the gym or in the sauna, and I'll just be open in the hope that it might help somebody else. So yeah, so that was my story, and I'm still on it now, and I wouldn't change it for the world. And there's always the bad rap of testosterone that you're going to go around, I'm going to go around beating my chest and mating with everything in sight. I'm happier, healthier, kinder, more emotionally intelligent, I believe, and just a better human than before. You're only ever replacing yourself into a natural range anyway. So you're just replacing yourself and getting yourself into an optimum range of where your body wants to be and where your body wants to function. I briefly didn't mention how the reason why men's testosterone is declining is we are living in a world of, we're not living the same lives that we used to live. Manual labor, we work inside a lot more. There's more stress. There's chemicals, there's environmental toxins. All of these things are reducing men's testosterone, and it's proven in studies consistently over time how it's reducing. So it's proven and it's happening. Also, I always kind of revert back to the whole evolution thing, if you believe in evolution, which I do, that technically you go back 100 years and we'd all pretty much be dead by 40. The menopause was not a thing at all and wasn't known about until women started to live past 40, 50, because essentially our bodies have evolved to live to that point, mate, procreate, die. Simple. So all of the things that are happening to us now, our bodies are hanging on, they're surviving, but they're failing us as well. And when a woman gets to 40, 45, 50, she speaks to the doctor. Sometimes it doesn't even have to be in person. And a week later, you've got hormones through the door to treat your hormone decline. We dish out hormones to 14, 15-year-old girls for whatever reason. We also do it to very young children that want to be from a girl to a boy. But we won't treat men that are struggling and are proving to themselves, that they have a problem and that needs fixing, and that is wrong. So I really, really hope that we can sort this out and talk about it. I know personally from experience, someone very close to me has been through the same, struggling, mental health, depression, anxiety, panic attacks. Goes to the GP, tests his testosterone. It's 6 on a scale of 10 to 30. Doctor goes, go away, maybe try this. Comes back, tests again, lower, below the lowest range for well over a year, and refused treatment. The guidelines clearly say if you're below 12, treatment should be given to you. So why is this happening? And why are men being treated in this way? I think we need to know why, and we need to improve this and help men. Probably a good time to go on to the sad statistics of suicide. Not very nice, I know, but very relevant to the topic. So in the UK, every 90 minutes someone commits suicide. 76% are men. Suicide is the biggest cause of death in men under 45, bar none. Suicide. And for every death there's 25 attempts of suicide. So sad. And I believe that this topic is linked to it, and we could be helping a lot of men's lives. Not only those men's lives, but when suicide happens, it's a cascade of effect of ruining everyone else's life as well. And so I really think that this could help. Yeah. So I'll quickly talk about the health impacts of low testosterone. So obesity, heart disease, high blood pressure, depression, sexual dysfunction, low fertility, muscle loss, and psychological issues. So not really a nice list, is it? Low fertility as well is proven men's fertility is reducing over time alongside testosterone. So again, proven in studies and not good. The suicides in males that I've just talked about, it's a huge issue. I know men don't tend to talk about things, and that's, I guess, what the reason for that. But also there's a reason why they're choosing to do that is, you know, sadness, anxiety, low mood, you know, the inability to think clearly and make good decisions is all linked to this low testosterone. So I will talk about the benefits of testosterone replacement therapy. So not only from my personal experience, better mood, increased sexual function, more energy, kinder, more loving, more empathetic, just generally feeling better, looking better. Yeah, increased muscle mass, increased bone density, which muscle mass is huge for men and women, especially as we age. So is lowering body fat. Obesity is one of the highest causes of all deaths and illnesses, and low testosterone is linked to obesity. And the more our testosterone drops, the more body fat we hold, and it's just a cycle of negative progression. And yeah. So the benefits of replacement therapy: so improve mood, energy and well-being, improve sex drive and erectile function, improve muscle mass, improve liver function and decreased inflammation, increased bone density, improved blood pressure, improved lipid function, cholesterol, etc., and reduced visceral fat mass, so fat mass around your organs, and increased in insulin sensitivity, which is a very big thing in terms of aging and longevity. Possible side effects, because it's important to talk about that as well. Testicular shrinkage. So men make testosterone via the testes from a signal from the pituitary. It tells our testicles to make testosterone. If you then give yourself testosterone via medication, your body will stop to create its own, because it's clever and it realizes I don't need to do this job anymore. So the way to fix this is, the reason why I call TRT HRT is because I don't just replace testosterone, I replace that signal as well through something called HCG, which is, I knew I'd forget it, human chorionic gonadotropin. Funny. Which signals your testicles to continue to work. So obviously I'm 40, and when I started it I was 32. A lot of men go on TRT and they don't take HCG because they don't mind having a slight bit of testicular shrinkage, and they might not want kids. So that's an option. I wanted to stay fertile, and I also wanted the benefits that you get from taking this drug. So I take HCG alongside my testosterone, so it's a dual approach. It's HRT, and both things keep functioning well. The prostate needs to be monitored. There's some links saying that prostate enlargement can be linked to testosterone, but I believe this isn't certain, and I believe it tends to be released to an increase in estrogen, because we don't get prostate issues when we're young when our testosterone is really high. So that's not a certain, but it is something that you should monitor, and you should get your bloods tested every 6 months, every year, to make sure you're healthy anyway. So yeah. How to check your levels. So I would say go to your doctor if you're worried, or if you're concerned, ask them to check everything, including your hormones. I did all my checks, and for the first year of being on treatment, and then occasionally still now, I will do a check through MediChecks, which is an online service. You get it through to the post. You'll take a finger prick blood test and it will tell you your hormone levels. You can do this for a variety level of hormones. The minimum you want to test is testosterone, estrogen, and free testosterone, because free testosterone is what isn't bound. It's what's available, and that's just as important as your testosterone level. You need that to be in the upper range as well, otherwise you're still eligible for treatment and there's still concerns around it. The treatment options: so if you can get the NHS to treat you if you're low, congratulations. But I couldn't, and I wouldn't advise it in terms of optimal health, because the treatment isn't optimal either, the way they treat it. I believe it's an injection once every 3 months, and people on the forums that are on that have shown that after about 8 weeks their levels are worse than before they went on treatment, so that's not good. I went to, as I said, the place called the Men's Health Clinic, which is in Poole, and I'm not having I don't get anything for these referrals. They might be happy if they start getting loads of people call them, but yeah, they helped me, so that's where I went. There are other places online that do it as well, but I liked the fact that I was going somewhere, I was speaking to a doctor, they were doing the tests, and if your levels aren't really low, they won't just treat you. They are treating the problem very well, and they're really advanced in this field, and so I trusted them, and yeah, they changed my life. So Men's Health Clinic, I'll put links to all of this in the video description. Again, no monetization, it's just helpful information, hopefully. So I think I've spoken about everything. I just want to finish by saying that I really hope this helps some men. The last video I know had like 1,000 views. So if 1,000 people watch this video and even half of you share this video, we could be, there could be 5,000 people that see this video, and if this saves someone's life, if this helps somebody live a better life, or even a few people, or who knows what, that's a good thing, and I'll be happy that I did it. Mental health, we know it's huge. Like, it's always talked about as Mental Health Awareness Day on Friday, I believe. And for the women in our life that go through the menopause, we care about them, we love them, and we want what's best for them. And so they get treated, and there's some women that have been suicidal again. I know that if crimes are committed, I think the menopause can be used in like mitigating circumstances for like not thinking straight and not having rational thought. So again, it just shows that if your hormones are not working correctly, it's a huge issue on how you think and feel and behave. And I know that men will be interested in this probably more than women, but for women to want to support men as well, in something which isn't talked about a lot, men wanting to talk, or men talking about their hormones, but I feel that that's a really beautiful thing if you can support a man, and to see him, I guess, feel happier and healthier, be a better partner, dad, if they're a dad. I genuinely believe this is something which will help a lot of people. So yeah, as a final thought, thank you for watching the video. I hope I didn't rabbit on too much. There's probably loads more I could have talked about, but I'll leave it there as that's 30 minutes. I appreciate you watching it. I hope that you share it. If you need to speak to me and you want to ask me any more questions in particular, then you're happy to message, more than welcome to message me. And I'm happy to talk about it openly and honestly about everything. If you are struggling, then there's help for you. There's forums, you can speak to me, and there's places out there where you can go and get help, and at the very least get yourself checked, see if this could be a problem. Don't go straight to antidepressants. Don't accept that you shouldn't be optimized and feeling the best a man can feel, and don't ever feel that that's wrong to feel, because it's not. So I'll leave it there. Thank you very much. Please share the video, and the next video will be probably about the sauna, I think, because that's game changer as well. All right, thank you very much. Enjoy the rest of your week. See you later.